If you've been researching sinus lifts or considering a zirconia implant as a more holistic alternative to titanium, this video is exactly what you need to see.
Let me show you our patient's panoramic x-ray. This was before the surgery. We did extraction and socket preservation about a year prior to this recent surgery. Well, we took this tooth out. The patient has a pretty soft bone based off of our 3D scans that we saw of hers. The reason why the bone looks like this even after a year was that we actually used a combination of sterile human bone, and we also used xenograft, in this case specifically cow bone. So basically what I wanted to do then also was I measured this with our 3D scan. The reason why this is super important is I can actually get measurements of how much bone she has before we hit the sinus. And why we're worried about going into the sinus is not necessarily that placing an implant in the sinus is an issue, but we want to make sure that when we place this implant, we have enough height. If we're going to bury a pole in the ground, we want to make sure that enough of that pole is buried in that ground so it gets enough support, right? So if I was to put up a mailbox post, you don't want to bury it in 6 inches of soil or concrete. You want to probably put it maybe 1.5 feet or 2 feet buried in the soil. Similarly, when we place a dental implant, we want to make sure that it's buried in bone and not just in empty hollow air cavities. We were able to see that we only had 7 millimeters, but we have good width here. So we could put the wide platform implant in here. But what I discovered was that when I was drilling up into this jawbone, the jawbone was just very soft. So I had to basically pivot and do what we call a lateral window sinus lift. And I'm actually going to show you this animation from this company called Deutschlich, which provides membranes and bone grafting. If you look at this 3D scan here, you could see that what they're showing you is how much bone that we want this implant buried in. But if you take a look at this, we definitely do not have enough bone. This would be the amount of bone. And just keep in mind, this is all the empty sinus cavity that we were talking about earlier. So we're going to create a little window through this bone. This right here is what they call a Schneiderian membrane. We are going to use special instrumentation to lift that up gently. We tell people it is like a wet tissue type of membrane. That's what the consistency is. So we got to be super careful not to tear that. That's one of the hardest things about the sinus lifting procedure. And then after we lift that up, we add all that bone. And then we can put a membrane on top. That's basically how you do a sinus lift. Here's what it looks like afterwards. And you could see all this added bone right here. And this right here is a zirconia implant because this patient wanted a more holistic approach versus a titanium implant. And what you're looking at is this is the area that we had created the access, and we added all this bone after lifting up the membrane. And then we were able to place this implant right here for her. Anytime we do a sinus lift, I prefer to wait 5-6 months before we start loading this implant.